Antiviral chemotherapy. Chapter 18. Antiviral chemotherapy. Antiviral chemotherapy. Introduction. About 69% illness is due to viruses. The conventional approach is to develop effective vaccine. So far, only 16 antiviral drugs for animal and human. Their uses in veterinary practice are questionable because of difference in virus and virus-induced replication. Virus obligate intracellular parasite need host genetic machinery for replication, narrow therapeutic index, and lack enzyme that function in energy metabolism, protein synthesis, and cell-dependent replication. Hence, they multiply only within the cell. Animal viruses may be single-stranded or double-stranded RNA or DNA viruses. DNA, RNA, DNA, pox, herpes, adeno, hepatna, papilloma, parvo, RNA, rubella, rhabdovirus, picorna, orthomyxo, paramyxo, parainfluenza, corona. Drug that affect the viral process must penetrate the host cell, and in doing so, they are likely to affect the normal pathway of host cell. Because of this close association between viruses and host cell, chemotherapy of viral disease is difficult and antiviral drugs are generally having narrow margin of safety. However, virus-directed enzymes have been characterized in infected cells, and these may have higher affinity for some inhibitor or anti-metabolites than normal host cell enzyme. Reason for failure of antiviral therapy. Reason for failure of antiviral therapy. Drug target virus process must penetrate the host cell. Lack of broad spectrum antiviral drug. Lack of in vitro susceptible testing procedure. Narrow spectrum drug target specific enzyme. Polymerase transcriptase involved in viral nucleic acid synthesis. Hence, development of resistance is easier. Point mutation, substitution of single important nucleic acid. Inhibit only actively replicating virus, unable to eliminate non-replicating or latent viral infection. Mostly virostatic, hence success depends on host immune response. The most successful use of antiviral drug is synthetic nucleosides that either inhibit DNA or RNA polymerase or act as chain terminator after incorporation into nucleic acid. They are effective prophylactically and in early stage. Rapid and early diagnosis is important. Viral replication. Viral replication. RNA virus. Direct need virion enzyme viral RNA polymerase to synthesize mRNA or viral DNA survey as mRNA. DNA virus. Indirect viral DNA transcribed to host mRNA by host cell RNA polymerase. Retrovirus. Unique make a copy of DNA from viral RNA with the help of reverse transcriptase. DNA is incorporated into host genome mRNA viral protein. Most of the antiviral drugs are nucleic acid analogs and interference with the viral nucleic acid synthesis, DNA or RNA or regulations. Drug may also affect virus specifically step like attachment to host cell, penetration and uncoating of virus in host cell, reverse transcription, virus assembly and maturation. The general approach to control viral disease is to develop effective vaccine, but this may not be always possible, and in such cases, chemotherapy is the only alternative. The main objective of antiviral chemotherapy is to eradicate the virus with little or no damage to the host and to prevent further viral infection. Only few antiviral drugs have been developed so far which are somewhat safe and effective against limited viral disease. Most of the drugs have been developed for human use and only a few have been studied in animal. In most of acute viral disease, the replication of viruses reaches peak when symptoms appear. Most antiviral drugs have greater effect against fewer infectious particles and show less efficacy when the disease is symptomatic. Therefore, antiviral drugs should be started early in the incubation period or such drug may be useful as a chemoprophylactic agent. Classification of antiviral agent. Classification of antiviral agent based on mechanism of action, preventing viral attachment to and penetration of the host cell, amantadine and ramitidine. Neuraminidase inhibitor, oseltamivir, Tamiflu and Zanamivir. Transcription analogues, ixoduridine, ribavirin and trifluoridine. Late translation inhibitor, methicillin and interference. DNA polymerase and DNA synthesis inhibitor, acyclovir, famciclovir, ganciclovir, cetrabine, vidarbine and foscarnet. Reverse transcriptase inhibitor, jodovidine, didanosine and stavudine. Protease inhibitor, sequinavir, indinavir, ritonavir and nalfinavir. Interference with protein synthesis, mitomycin and pyromycin. Interference with viral maturation, rifamycin and streptoviricin. Host immunomodulators, interferons, gamma globulin, polyfast policy, BRL 5907 and levomethol. Based on type of virus affected, anti-herpes virus, edoxuridine, trifluoridine, vidarabine, cytarabine, acyclovir, ganciclovir, panciclovir, cidofovir, foscarnet etc. Antiretroviruses, zidovidine, stavudine, didanosine, senquinavir, indinavir, ritonavir and nalfinavir. Anti-influenza virus, amantadine, ramentadine, oseltamivir and zanamivir. Antipox virus, methicillin, antiviral antibiotic, rifampin, bleomycin, actinomycin, D, mitomycin and puromycin. Non-selective interferon induced polyfast policy and BRL 5907, gamma globulins and levamisole. Amantadine and its derivative ramentadine are synthetic tricyclinamine. They lead to inhibit or delay of the uncoating process and also interfere with early stage of viral mRNA transcription. At usual concentration, highly effective in inhibiting replication of different strains of influenza virus. It is used as chemoprophylactic agent, almost completely absorbed from GIT and 90% is excreted unchanged in urine. It produces fewer side effects related to CNS. Aerosol administration reduces the toxicity. Veterinary usage, prophylaxis in equine influenza, influenza in chicken and turkey, treatment and prevention of influenza A virus in men. Idozuridine, first antiviral drug used clinically in men. Pyrimidine nucleoside, being a thymidine analog, It competes with thymidine and get incorporated in DNA, resulting in formation of fold DNA which breaks down easily. The DNA directs the synthesis of wrong viral protein. Viral components are produced in the host cell, but infective viruses do not arise. Effective against DNA virus only and is indicated in treatment of corneal and skin infection with herpes virus in man and animal. Has high systemic toxicity, bone marrow depression. Acyclovir is equally effective and better tolerated alternative. Used as 1% ophthalmic solution, one drop topically every 1 to 2 hours. Vidarabine, 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 adenine arabinoside era A. It is an adenine analog which is phosphorylated by cellular enzyme to triphosphate that inhibit many viral and human DNA polymerase and thus the DNA synthesis. More selective than iodozuridine but less to than acyclovir. Used topically for ocular herpes infection and systemically for herpes simplex encephalitis, for mucocutaneous herpes and pox virus infection, but now has been replaced by acyclovir. May produce bone marrow and CNS toxicity at higher doses. Applied as 3% ophthalmic ointment, 0.5% CM ointment, applied topically every 5-6 hours, 3-6 times daily. Trifluoridine, trifluoridine related to iodozuridine and analog of deoxythymidine, current drug of choice for herpes simplex keratinitis in men. Used as 1% ophthalmic solution, one drop topical every 2 hours for 2 days and then for 8 times a day. Citrarabine, adenine arabinoside era C, analog of cytosine deoxyribose. In cell culture, it has activity against herpes virus, pox virus, vaccinia, and rabies virus. Topically active against herpes virus and vaccinia keratitis, but systemic antiviral activity has not been established. Acyclovir, synthetic acyclic purine nucleoside analog of second deoxyguanosine. It is selective for viral rather than normal cell. Unique mode of action, it is initially phosphorylated to acyclovir monophosphate by a virus-specific thymidine kinase, and this monophosphate is again phosphorylated to acyclovir triphosphate by cellular kinase. Acyclovir triphosphate completely inhibit herpes virus DNA polymerase, also get incorporated in viral DNA and stop longithining of DNA strand. The terminated DNA inhibit DNA polymerase irreversibly and thereby stop DNA synthesis. Relatively safe, less cytotoxic, and have wide margin of safety. Breakthrough in antiviral chemotherapy. Acyclovir is not phosphorylated in normal cell because of lack of viral thymidine kinase, non-toxic to uninfected cell. Valacyclovir, decyclovir are prodrug developed because of 90% of acyclovir is excreted in urine intake. Human herpes simplex first and second, varicella zoster virus chickenpox, veterinary use, equine herpes in fall, topical local herpes, bovine herpes, mammalitis, equine coitus, exanthema feline, rhinotracheitis, viral keratoconjunctivitis, gencyclovir, Gencyclovir, synthetic guanosine analog, also an antiviral purine nucleoside, similar MOA like acyclovir, more active against cyclomegaloherpes virus than acyclovir in immune-compromised patient. Administration through IV, high systemic toxicity, bone marrow depression, neurological toxicity, neutropenia, and thrombocytopenia are adverse effects. Veterinary use, cytomegalovirus infection, ribavirin, ribavirin, tribavirin, synthetic purine nucleoside and guanosine analog. It is activated by viral phosphorylation and subsequently prevent the formation of mRNA and translation of viral genome. Its mono and triphosphate derivatives generated intracellularly inhibit GTP and viral RNA and polypeptide synthesis. Broad antiviral activity against many RNA and DNA viruses like adeno, herpes, orthomyxo, paramyxo, pox, picorna, rhabdorota, and retroviruses. Resistance is rare. Aerosol respiratory syncytial virus, bronchitis, influenza. Veterinary uses influenza, parainfluenza, bovine herpes virus, canine distemper, blue tongue, Marex feline calcivirus, topical local herpes infection, not feline, vaccinia teeth lesion, administered topically, IV, orally, or as aerosol, in influenza, measles, herpes infection, acute hepatitis, and viral bronchitis in men. Causes GI disturbance, bone marrow depression, and anemia. Inhibitor of reverse transcription, azithromycin, azidovidine, azithromycin, azidovidine, AZT. Thymidine analog, mainly effective against retrovirus and used in human in treatment of HIV. After phosphorylation in the body, zidovudine triphosphate selectively inhibit viral reverse transcriptase RNA-dependent DNA polymerase required to convert single-stranded viral RNA to double-stranded viral DNA in preference to host cellular DNA polymerase. Suppress only active viral replication. Already infected patient cannot be treated. Administration only through IV. Toxicity, granulocytopenia and anemia. Veterinary uses retrovirus, FELV, FIV, equine infectious anemia, ELA. In HIV patient, prolongs survival, decreases opportunistic infection, and increases the immune function, decrease HIV antigen and RNA when combined with diagnosine. Phoscarnate, a phosphate act by inhibiting viral DNA polymerase and reverse transcriptase. It has high nephrotoxicity, clinical use similar to gencyclovir, sanquinavir, indinavir, ritonavir, and nelfinavir. In HIV, the viral mRNA transcribed from the provirus is translated into two inert polyproteins. A virus-specific protease converts this polyprotein into virus structure and functional protein by cleavage at specific position. HIV-specific protease inhibitors bind to the site where cleavage occurs and thereby inhibit the synthesis of viral protein. Since the protease does not occur in the host, these drugs are highly effective in therapy of AIDS in combination with reverse transcriptase inhibitors, diadenosine and stavudine. diadenosine and stavudine, similar to zidovudine and AJT, and they are indicated in HIV patients not tolerating AJT or for AJT resistant HIV. Methizazone, an statin 3 semicarbazone, effective against pox and adenovirus, used in treatment less active and prevention of smallpox in men, must be administered orally, may cause anorexia and vomition, act by preventing the replication of virus by inhibiting late translation of mRNA, thereby blocking the synthesis of structural protein. Rimantadine, 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 more potent and long-active derivative oseltamivir and zanamivir. Oseltamivir and zanamivir. In influenza virus, the action of neuraminidase is involved in budding of new virus from infected cell. This drug acts by inhibiting the action of this enzyme. In treatment of bird flu, these drugs are commonly used. The bird flu virus may show resistance to amantadine or rimantadine, hence oseltamivir and zanamivir is preferred. Rifamycin, rifampin inhibit viral mRNA polymerase and interfere with the assembly of viral protein and maturation of viruses. Antisense oligonucleotide, antisense oligonucleotide. This sequence of a nucleotide chain contain information for protein synthesis is called sense sequence. The complementary strand is antisense sequence. Antisense drug recognize and bind to sense sequence of specific mRNA, prevents synthesis of specific protein, destruction of mRNA by ribonuclease in cell, viral genome mRNA sense strand mRNA drug, inhibit viral mRNA translation, immunization and interference. Immunization and interference. Immunization. Passive immunization by IM, IV or SC injection with immunoglobulin can prevent entry of virus into cell. The proteolytic effect lasts for several weeks but may not be complete. This is useful to control CD, rabies, TBT and gastroenteritis in swine, infectious hepatitis, measles, poliomyelitis, chickenpox. If hyperimmune serum is not available, pulled sera from the recovered or vaccinated animal may be used. To avoid anaphylactic shock, only one injection should be given. Gamma globulin are concentrated antibodies excreted from normal blood may also be useful in preventing viral infection prophylaxis in man and animal. Interferons. These are cytokinin or interrelated group of protein released by cell infected by virus. Interferon IFN possess antiviral, immunomodulatory and anti-proliferative effect. They are highly species specific. They make neighboring cell less susceptible to viral infection and contribute to host resistance. They have non-specific antiviral activity and inhibit many RNA and DNA viruses. They are host-specific and interferon from one species cannot be used to protect another. Three types are recognized. INF alpha leukocytes, INF beta fibroblast antiviral action in response to viral infection, especially RNA virus. INFY or lymphocyte A antigen or mitogen stimulation immunomodulation. They inhibit all the step in viral multiplication, bind to specific cell surface receptor, and inhibit viral penetration, uncoating synthesis of mRNA, translation, assembly, and release. It can be administered SC, IM, IV, or locally. It is an important part of defense mechanism. They are produced by recombinant technology. IFN production by tissue culture is costly. Bovine IFN alpha gamma produced by genetic engineering, interferon inducer or host modulator. Some fungal metabolites have this activity induce production of its own interferon. High molecular substance like polyphase polyC, a synthetic polyribonucleotide also induce interferon. Partially effective in dog against viral hepatitis. Action of interferon protect animal against viral infection. Antiviral drug used in AIDS HIV protease inhibitor. Sofenavir, ritonavir, indinavir, nelfinavir, amprinavir. Thank you. Thank you.